Good morning, everyone. My name is Rob Rodney. I'm a health educator with VCU's HIV education program in Richmond. We'd like to welcome all of you to day 2 of the Virginia Ryan White Case Management Summit. There are over 250 of you from 61 agencies across Virginia. Welcome agency leaders. Thank you for supporting the growth and training opportunities of your staff. Welcome medical and non-medical case managers. Thank you for your tireless efforts in serving people with HIV in Virginia. Welcome to members of the Virginia Department of Health. And finally, we'd like to say a special welcome and thank you to Kim Brown from HRSA. Kim Brown is the HRSA Program Officer for the Ryan White Part B program. Thank you for being with us today. Before we get started, we want to take a moment to orient you to some of the tools available to you in the Attendee Hub, which is the website you're currently using to view this session. On the top of your screen, you will notice a navigation bar with many links to great networking opportunities and tools which may be helpful to you during the summit. The Schedule tab will show you all of the sessions as well as on-demand sessions. All sessions are being recorded and will be available to you on demand for 90 days after the summit. Next, we have the Community tab. Under the Community tab, there is the attendee list. In here, you can see who is attending the summit and send individuals instant messages. Next, under the Community tab is the Discussions page. In here, we have discussion rooms that will be open during the networking sessions. There are rooms for agency leaders, medical case managers, non-medical case managers, and even a room for VDH staff. Moving across the navigation bar at the top of your screen, the next tab is the Agencies page. During the networking sessions, you can view agencies from across the state. For agencies that have chosen to have a Zoom room, you can even meet with their staff. Please note that in order for the Join Now button to work on an agency's page, the agency staff must have requested a Zoom link and they must open that Zoom link. If your agency did not previously request a Zoom link but would like one today, please email elizabeth.wanko@vcuhealth.org and we'll send you that link. Finally, we have the More tab. In here, you can learn more about the Planning Committee, sign up to serve on next year's Planning Committee, see helpful links, get a sneak peek at next year's summit, and review speaker disclosures. If you have any questions as you navigate throughout the day, please don't hesitate to reach out. Please enjoy day 2 of the Virginia Ryan White Case Management Summit.
Good afternoon. As the Quality Management Specialist with HCS, it is my privilege to introduce the Provide Unified Eligibility session led by Safri Diawara, Clinical Quality Management Coordinator, Kimberly Ely, Assistant Director of Medication Access, Jonathan Albright-Williams, Ryan White's Grants Manager, and Ashley Yoakum, HIV Care Services Planner. We will hear more about recent developments regarding the Provide database and updates on unified eligibility. First up, we have Safri Diawara.
So thanks to Camelia. So we're gonna talk to you a little bit about the Ryan White Unified Eligibility. And like you know, Virginia Ryan White HIV Care program. And the mission is to coordinate some culturally competent medical and support services throughout the state, and also to enable people with HIV to successfully navigate complex health and human services system, and to increase and sustain self-sufficiency and overall improve their health outcome to give them quality of life. So what's the background of the unified eligibility? I'm gonna give you some background information. So the program is just focused on getting all the support and core services we are providing to be compliant with states and national guidelines, and also to improve people access to care. But Virginia has been very low in reaching the EDAP recertification rate, which is a little below to the national benchmark. And EDAP is the Aid Drug Assistance Program. So to address that, VDH has conducted numerous eligibility efforts in the past. We started in 2015 and to develop the case management standards. In 2018, we implemented several quality improvement projects and to assess and improve our EDAP recertification rate. And 2018, 2019, and our Virginia Consumer Advisory Committee, the VACEC, did a good job in educating consumers, their peer, on EDAP. So in 2020, and we tackle, adding a new database called Provide Enterprise. And the data system will help us to streamline the eligibility process for all involved. And 2022 will be the year of the implementation of the unified eligibility as well as the new database Provide. This is just a data showing you what was our effort in 2018. So we work with our partners, the Eastern Virginia Medical School, and to implement a joint eligibility processes, and with the Ryan White Part A, and also with the Ryan White Part C. That was a cohort of a patient we take for the 12 months, and you will see the baseline. And for Ryan White Part B was 35. And by the end of the year, in January 2019, we were able to improve the recertification rate from 35 to 78. For the cohort of the Ryan White Part C, we started with a baseline of 65, and was able to improve the rate by 85 by the end of the year. So what the data is telling us? And it's telling us that we can be able to improve the recertification rate. And the QRP and also was supported by some communications, process improvement, education opportunities, and partnership with our sub-recipients, and to see how to implement the joint eligibility. We had a recommendation from the Quality Improvement Project to keep working closely with our partners on the eligibility and recertification rate improvement, and also to keep using the EDAP list we send to our sub-recipients and through the portal, and just telling them those are the clients who need the recertification and communicating the due date to them. Now, that was the background. And let's just see what the unified eligibility implementation will look like. HRSA just released policy clarification 2102 and on the determination of clients' eligibility and payer of last resort in the Ryan White program. So that gives some flexibility to the state, and it requires some periodic check of the Ryan White program to identify any potential changes that may affect eligibility. So that remove the mandatory 6 months recertification, and allow also Ryan White recipients and sub-recipients the flexibility to timely conduct eligibility confirmation. So if we were at 6 months, and this policy clarification is giving some flexibility to the state to think what is good for them. And the immigration status shouldn't be included on any of the Ryan White eligibility and the determination processes. So what is unified eligibility? So we think unified eligibility is a process to assess people eligible for Ryan White program, including our Virginia Medication Assistance Program, through one assessment and application according to the established Virginia Ryan White Part B requirement. Nothing will change with the eligibility requirement, but all the eligibility will be done through one portal. That's gonna be the big difference. And we're gonna do the client's access review, and that should include assessment of changes in the income, residency, and insurance coverage. So after giving the definition of the unified eligibility, I will let Jonathan Albrecht Williams and to give you more information on the unified eligibility. Thank you.
So thank you, Safri. I want to begin with helping us all calibrate to this new process. Although the unified eligibility process is built on our current process, there are new updates that we have established to improve the quality of access and care for our Ryan White clients. We will start with a foundational or basic understanding of unified eligibility. So when we're talking across our HIV care service delivery system here in Virginia, we are all speaking the same language. Things like terms and goals are to really help us conceptualize implementing this into our everyday system of care. You heard the definition from Safri as it's displayed on the screen on what unified eligibility really means. And you really can think of it as one door that clients open to access all Ryan White Part B services. So simply put, there will no longer be an ADAP application and a separate application or eligibility intake at the subrecipient level. Unified eligibility does combine eligibility assessment into one process. So let's talk about goals and the impact of the unified eligibility. These really speak to the heart of VDH reaching the decision to unify our eligibility process. We have heard from you, our subrecipients, and our clients, and even our own Ryan White staff, that we need a simpler way for clients to access all services. So here are some of those goals that unified eligibility really brings to us. It allows us to have timely processing of client eligibility. It ensures us for timely access to our clients' timely access to all services, including medication access. It avoids duplication of efforts for both the central office through VA MAP and our Part B subrecipients. And ultimately is to optimize health care outcomes and prevent new infections in our communities. The benefits are really threefold, and they really address the administration burden, client burden, and information sharing. Through unifying eligibility, we are reducing the heavy load of a dual eligibility system and looking to improve client access and even data sharing with our subrecipients. So we see here, there's some real tangible benefits for unifying our eligibility. Most of it deals with, as I said, the administration burden and client burden of having to do multiple applications throughout the year. Unified eligibility allows us to streamline as well as share data in real time with our subrecipients regarding our client's eligibility. So let's dig into some common terminology you will hear moving forward under unified eligibility. First off, unified. It simply refers to a process of combining separate eligibility verification for ADAP and another eligibility verification for all other Ryan White Part B services, and rolls it all into one assessment that's done on behalf of the client. Eligibility assessments. It simply refers to the process to verify a client being eligible for all Ryan White Part B services by meeting all of our Part B client eligibility criteria. And we'll refresh that in a minute. Client access reviews, or CARs, it refers to the periodic checks for enrolled Part B clients to identify any potential changes that might affect their eligibility. Case managed. This refers to clients that are assigned to a medical case manager or a non-medical case manager who then helps the client access other all Ryan White services as needed. And then you will hear the term not case managed. And this refers to clients that do not currently have an assigned case manager to access any of the Virginia Part B services. This usually happens when a client only is accessing ADAP services through Virginia MAP. So these are some terms you will hear throughout the rest of this presentation and implementation of the unified eligibility process. Next, we will discuss guidelines that are really to help us steer our unified eligibility process into being successful. So as I said, first things first, defining eligibility. Nothing here changes for us under the unified eligibility process. It's the same one that we have heard throughout the years for our clients to be eligible for any Ryan White services that included in Virginia MAP as well as at our subrecipient level. And so clients must continually meet the Virginia Part B eligibility criteria and all the conditions at all times for their service. Verification of HIV positive status, that they will only have to provide once at the enrollment. Verification of residency in the Commonwealth of Virginia. Verification of household income of equal to or below 500% of the federal poverty level. And proof of insurance or other insurance coverage, including Medicaid assessment. Now let's look at what does change beginning April 1, 2022. All persons receiving any Part B service must have their eligibility assessment completed by a funded Ryan White Part B subrecipient. This is a change for both our clients and our subrecipients. And we want to support the process of ensuring clients are able to access all services they need for a better health outcome. Our goal is to not have clients fall through the cracks, and the way that has been proven most effective is by having our subrecipients being that door for clients to access all services. Secondly, subrecipients will conduct full eligibility assessments every 24 months. I will pause for the virtual applause. But what this really does, and if you remember what Safri mentioned about PC 2102, this allows the flexibility where we are able to implement and lessen the administration burden and really put client care at the center of our focus. And so this means that our subrecipients will have to do a full eligibility assessment every 2 years. Our new client level data system will be able to help with this monitoring. And lastly, subrecipients should conduct client access reviews or CARs, which I will talk about in our next slide, on a periodic basis to identify any potential changes that affect eligibility. And most critical here is to report all changes and provide the supportive documentation and provide. So let's explore the CARs a little bit further. Remember in HRSA PCN 2102 that entitled Determining Client Eligibility and Payer of Last Resort in the Ryan White Program, it states that it requires periodic checks of the Ryan White program to identify any potential changes that may affect eligibility. So our subrecipients will have to do regular checks to ensure compliance with Ryan White's program's policy and eligibility. VDH will also do periodic checks to ensure compliance and changes are documented in our Provide system. And we will hear more about Provide that will help both VDH and subrecipients have access to the same client information throughout those 24 months of eligibility. VDH asks that you do these CARs or periodic checks throughout the year until the next eligibility assessment is due. Remember, full eligibility assessments are now due every 24 months for clients. Any changes between that all must be updated and sent to VDH with supportive documentation in our Provide system. Next, CARs can be completed when you have any contact with clients for service planning, service delivery, phone calls, or visits conducted by outreach staff, etc. And you can really think about this every time you yourself go to visit the doctor. They always ask you, has anything changed? Has your insurance changed? Your address changed since the last time you visited us? And that's really what CARs are for us with the unified eligibility. It's really to access if there has been any changes to our client's eligibility status. And a last thought on CARS, just think of them as the vehicle for clients to keep their eligibility and access to care for the best health outcome. So now I'll turn it over to Safri to help us drive home the unified eligibility.
So thanks, Jonathan. We'll just keep giving you more information on the unified eligibility. And we will have two groups of patients. The first one will be those who are case managed clients. Those are clients who are already receiving medical case management, non-medical case management, or are receiving other services, RAMWAT services, and through funded agency. So the eligibility will not change, and it's going to be in the same process like you're doing now. And we have a second group of patients. Those are the clients who are not case managed now. They're not getting any services through your agency, but they are like self-managed, they do their eligibility by themselves. Because now it's going to be mandatory for them to go through an agency, and they're going to be requesting some assistance from you. And the assistance can be provided by case managers, by intake specialists, by social worker, and whoever can help them to assess and to complete their eligibility. And those services will be also recorded under the psychosocial services in clients data recording. So when you got the request from people to help them with RAMWAT eligibility, we just encourage we're asking you to accept those requests and work with the clients to collect all the needed information, documentation, and upload them under the provide enterprise. And you're gonna use the electronic intake and eligibility form. So sub-recipients will complete and document all the established eligibility determination. And also you need to review the requests and truly review all the documents before you upload them into the provide. And like I said, clients who are not case managed and coming to the site just for the eligibility application assistance, you can record those services under the psychosocial support services. Every client who complete the intake process will have also a sign and the consent form on the system. Continuation of eligibility. And like Jonathan said, we're moving from 6 months of recertification to now 24 months of eligibility time period. So the full eligibility will be done every 24 months. And in between, you need to do the client's access review. And like you said, like we go to the primary care doctor, I just asking you, what about your residency, your insurance status? That's what we are asking people to do. If you identify any changes, then you need to collect the document from the clients and upload them into the provide. Please use a reminder system in place and to assist with contacting clients who are nearing their client's assessment due date. Provide is the good tool. If you go to the provide, you will see when the eligibility is due. And I will say 6 months before you need to start getting a plan how to get in touch with those clients and be sure their eligibility is not outdated. And the conduct card, the clients access review at least once per year or at all the encounters. That's the best practices. Anytime clients is in office, please use the opportunity to assess about the eligibility status. And you can also develop and put a system in place to conduct follow-up with clients who don't complete assessment on time. And you can use also non-MAI outreach services category for that. And you have several options to help you with the clients and access client access review. So that's briefly the end of the update on the unified eligibility. And we're gonna move forward to provide some information on the provide enterprise system. Kimberly Ely, the Assistant Director for Medication Assistance at VDH, will provide some information on the provide enterprise system.
Thank you, Safri. So I am going to give a little information about the provide system, and Ashley Yoakum will also give some information regarding provide. As mentioned, Provide Enterprise is our new client level data system. I'm going to give a general overview of the Provide system, talk about our implementation phases, and then Ashley will talk about some of the advantages to the Provide system and give you some resources. So this new client level data system, we procured from a group, a vendor called Group Rare Technologies. They have been working hard in building this system out for us for quite a while now. This system will be used, as referenced earlier, for our Ryan White Part B eligibility and tracking of Part B service data. This system is replacing prior systems that we've used for capturing our service data. As most of you will recall, we had a system called E2 Virginia, and some of you have now been using RedCap for capturing your service data. The Provide system will replace both of those entities. Provide is also going to be replacing the system that we use in ADAP called Contacts Database. So now this one system houses all Ryan White Part B services, including ADAP. The system allows for electronic submission of eligibility applications, and they are now known as assessments in the Provide system. So the applications and the supporting documentation can be submitted in this electronic platform. There will be other programs within our Division of Disease Prevention that will also use the Provide system. So please be on the lookout to see modules for Charlie services, status neutral, PrEP, data to care, and rapid start. All of those will be in the Provide system as well. Let's talk a little bit about implementation, just to give you a review of it. We have been giving updates about implementation over the last year. But just to recap, implementation began in November of 2020. There are 3 implementation phases. Our estimated timeline for our implementation phases covered a period of time from November 2020 to March 2022. We have had a couple of delays in our implementation process, so that may get extended past March of 2022. So in phase 1 of the implementation, we focused on creating the foundation of the system, what is known as the client profile. We also focused on setting up all the VA map components in the system. So phase 1 go live occurred on August 30th of 2021. At that time, our VA map team has been able to utilize the Provide system to process assessments. These assessments were submitted by our subrecipients through the web portal. The Provide web portal provided a way for subrecipients to submit the information to us while we wait on the implementation of phase 2, when they will have direct access into the Provide system. The Provide web portal is still accessible at vacare.providecm.net. So any agency that is not able to utilize the Provide system can still use the web portal to submit assessments. But most agencies have received access to the Provide system in phase 2. They are now able to enter assessments and do data entry for their services through the system. Phase 3, which we are just starting, will focus on implementing other components like our Medicaid back billing, incorporating more reporting elements, as well as some final pieces to our status neutral and data to care program. Now I'm going to turn it over to Ashley Yoakum to talk about some of the benefits.
Thanks, Kimberly. Now we'll talk through some of the benefits of the Provide system for our subrecipients. So as we mentioned earlier, the system will allow for the electronic submission of all eligibility assessments for all Ryan White Part B services, and it will also allow for the upload of necessary documents required for eligibility assessments. And then based on the assessment and the required documents, the system will actually calculate the eligibility for the client. And so being able to have client eligibility and service data in Provide should allow for subrecipients to move away from paper-based client files. The system will also allow our subrecipient staff to see information related to a client's medication access services within the system, including what VA MAP program they have been enrolled in if they are enrolled in a VA MAP program. And lastly, subrecipients will be able to share information between clients if either the clients move to a different agency or if there are clients that receive services from multiple agencies. So you will no longer have to send eligibility paperwork between agencies. You will be able to now see it within the Provide system. Okay, and now a few benefits of the system for VDH Central Office. Similar to subrecipients, this system allows our VA MAP staff here in VDH Central Office to move away from having paper-based client files, as everything will now be housed within the Provide system. As well as now that subrecipients will be completing eligibility for all of our Ryan White Part B services, including medication access services, as well as having the system calculate eligibility for our clients automatically, this will allow for our VA MAP staff to be able to focus on arranging logistics for medication access for our clients. The system will also allow for direct communication with both providers and consumers regarding their eligibility status and VA MAP information. Lastly, this system will now house data from multiple DDP programs, making it easier for VDH to utilize our data to inform decisions and planning purposes for the future. And lastly, here are some resources available on the Provide system. VDH has created a dedicated website for Provide resources. The setup is similar to the DDP REBCAT page on our VDH website. Resources available on that website include Provide installation instructions, links to all of our recorded trainings, manuals created by Groupware Technology for the system, any user ID request instructions, Ryan White Service Report or RSR guidance, as well as any other pertinent updates to the system. We have also created a dedicated VDH email for all Provide questions, as well as any additional support needed for utilizing Provide. Lastly, for any technical or software questions regarding the Provide system, we have also included contact information for the Provide help desk that's run through the Groupware Technologies. Okay. And now we will move on to the live session for questions and discussion. Thank you. All right, so we are now going to move into some polling. Before we jump into our Q&A, you may notice that these questions will be similar or the same as ones that we did at the QM Summit, but we would like you all to respond. And so Brad, if you can pull up the first poll question. All right, so the first question is, so to get to these polls, you will need to go to the website you see here, pollev.com/B Williams 707. You can also, and then you should see the question and you'll be able to respond there. And so the first question is, what are anticipated advantages of moving to unified eligibility? So again, to respond, you'll just go to the website you see, the pollev.com/B Williams 707. And then you should see the question there where you'll be able to respond. There we go. So we'll give it a couple of minutes for more folks to respond. All right, we'll give it just a couple more seconds on this one and then we'll go to the next one. So far, it seems like less paperwork seems to be the big winner, and less and being able to share eligibility paperwork within with multiple agencies. And then if we can go on to the next question, and you can. All right. And so then similar to the last question, but kind of the opposite. Anticipated challenges in completing eligibility assessments for clients that are not case managed. Just as a reminder, we have switched questions. So this one is asking about anticipated challenges in completing those eligibility assessments for the clients that are not case managed. right. Seems like we have some responses coming in. Seems like so far the biggest one is going to be finding them or locating them, or how the client is going to find the agency. Seems to be the biggest anticipated challenge so far with this. All right, we'll give it a couple more seconds. All right, and then if we can move to the next question. All right, so for this one, we're asking about challenges that you have encountered in either accessing or logging into the Provide system. I am excited to see a couple nuns. Just as a reminder, again, we have switched questions. So this question is asking about the challenges of either accessing or logging in to Provide. And I am starting to see a couple come through. So thank you. And we're asking these to help with kind of what issues we're seeing within the system, so we can work to fix them. All right, we'll give it a couple more seconds for this question, then we'll move on to our next one. All right, if we can move to our next question, since it seems like responses have slowed down for this one. All right, and then what additional training needs do you have in relation to either unified eligibility or the Provide system? And so now we're asking about training needs that you need, again, either. Okay. All right, so we're seeing a couple come through. Looks like some folks are requesting general training, some training on how to log into the system, insurance rules. So logging in seems to be a frequent one. Let's see. That's how to assist clients. Again, a big one seems to be logging in and navigating the Provide system. Trainings on how to save progress notes. All right, as a reminder, there are some trainings up on the website as we showed you in the presentation earlier. So if you need access to those, you can email either myself or Kimberly Ely, and we can provide that link to you for some of the initial trainings that were done previously. Right, we'll just give it just a couple more seconds and then we will move into our multiple choice questions. Case scenarios for clients. Yeah, and then if we can go into our multiple choice questions, Brad. Okay, so for this one, you're going to go to, you're still going to stay there at that website. And this one is going to be a multiple choice. So do you think moving to unified eligibility will help with Virginia's eligibility compliance and improve access to care for clients? All right, so it looks like overall a good number of people do believe that moving to unified eligibility will help, although it nope, looks like a portion are not sure yet. All right, we'll give it just a couple more seconds on this question, and then we'll move into the next one. All right, if we can go into our next poll question. All right, what do you think of the 24-month time frame for conducting full eligibility client assessments? Just the right amount of time, should be longer, or should be shorter? All right, so right now, we're seeing a small majority think that 24 months is just about the right time. We do have a, a smaller percentage who think it should be shorter. All right, Brad, if we can go into the next question. All right, so switching to questions about the Provide system. I have access to Provide Enterprise and can log in successfully. And for those that do not access, you can just select that option as well. I'm excited to see that more, it seems at the moment at least, that more people are able to log in successfully. So that is good to see. All right, we'll give this one just another few seconds and then we'll move into the next question. All right, if we can move into the next question. All right, so I understand how the Provide Enterprise system will help with unified eligibility. All right, this one seems to be very mixed in responses. All right, looking right now at about 50% who say yes. All right, we'll give it just a couple more seconds on this question and then we'll move into the next one. All right, if we can go on to the next question. Um, uh-oh. Pardon, I think we're having technical difficulties. Give us one moment. Okay, so for this next question, it looks like some have already started answering this one, so thank you. I have attended at least one of the following. One of the Provide Enterprise Training webinars, 2 Provide Enterprise Training webinars, or I've attended all the Provide training webinars I could take. All right. And for these, just as a reminder, if you missed out on some of the Provide training webinars, they are posted to our website so that you can view them at a later time, or even if you just need to review them for a refresher, especially as folks are still getting access to the system. All right, we'll give this one a couple more seconds and then we'll move into the next question. So far, it looks like a good number of folks have taken the trainings, all the trainings that they could. So that's good to see. All right, if we can go into the next one. All right, so this one is just to get a feel for how you all are feeling about the new Provide data system. So it's been easy to use. The system is somewhat easy, but you still have some questions. It's difficult to use. Again, you don't use the Provide system in your role. And then the last option is you've requested access to Provide, but you have not gotten access yet. All right. So it does look like, all right, so right now it does seem like a number of you are still finding the Provide system difficult. So we're hoping that with some of these responses, we can provide some more assistance to make it easier to use in the future.
I'm not sure I understand.
Oops, sorry about that. If we could, will you be on this one for another second or two, and then we'll move into what I believe is our last question. All right, and so now what information do you feel will help you the most with implementing unified eligibility? Right now it looks like over half or about half would like more training on both helping with non-case managed clients, as well as more training on the provide system, as well as more staff. All right, we'll give this one another few seconds, and then we will move into the Q&A portion. All right, so I thank you everyone for all of your responses. These really will help as we try to provide more training for both unified eligibility as well as the provide system. And as we're moving towards unified eligibility this April, these will help us with what questions people have and maybe as well as what issues people are still having with the provide system. So we really do appreciate all your responses. I think now we will move into the Q&A session.
All right, thank you so much, Ashley. All right, so we have our first question in. For the 24-month full eligibility assessment, does that mean for someone that had an annual eligibility, for example, in November 2021, they won't have another for 24 months, or will the 24-month clock start when their next annual after 4/1/2022?
The answer is yes. The eligibility period is valid for 24 months. That month, you can do the continuation of eligibility, what we used to call renewals of the eligibility only at 24 months. Now, in between the 20 months and the first months of the eligibility, we need to do the client's access review. That's the best practice we're asking everyone, and mostly the case managers. Anytime you have an encounter with the clients, please just review the 4 elements of the eligibility. Be sure those are up to date. And if there's any changes, then work with the clients to collect the updated information and upload it onto the provide. If you upload any updated information within that 24 months, that's not a renewal of their eligibility. It's just updating their eligibility document. But the full eligibility, and continuation is due at 24 months.
So to add to what Safri just gave, which is all correct, One of the things that we are still reviewing and discussing with GTI, Group Rare Technologies, the entity that helped us create the Provide system, we're looking at how we can get some of your eligibility information that you've done on clients into the Provide system. Because right now, since we started using Provide, basically as of August 30th, any assessments that have been done, and they were done from the perspective of, eligibility for VA MAP. But in this system, that assessment will count for all eligibility, all Ryan White services. So anyone who has a date in the system right now, technically that's kind of their set eligibility date. We've been talking with GTI to see if we want to leave that as such, or if there's a way for us to bring in the information that some of you have in your systems on their eligibility dates. That's been a question that has been asked in some of our sessions, and we're kind of talking through how we can best make that work for everyone. So those are still things that we're talking about that we'll give you further directives on before April 1st. But we have heard your questions about that. We're just talking through the best way to establish that eligibility date in the system. And I will tell you, we've already spoken to GTI about the reprogramming of our Provide system, because it is, if you guys remember from prior meetings and discussions about Provide, it was already set up on the whole 6-month eligibility time frame, and we just have not actually turned that functionality on at this point. So they are going to be working on reprogramming it to the 24-month time frame for us. But as we're talking through, and that conversation will continue next week, several of them were out for vacation this week. Once we continue that conversation with them, we'll see when that 24-month period will start, because it may actually start with some of the existing stuff that's in the system, anything that's been submitted since September 1st. But we will definitely let you know that before April 1st, probably within the next week or so.
Thank you. All right, for the next question, is unified eligibility across all parts? Has there been any communication with Ryan White Part A in the Eastern region to support buy-in to this process?
Hi, it's Kimberly Scott. I'll take this question. So the Provide system, we've actually talked with the Part A in DC, because they were actually procuring a new client level data system. The procurement and the system actually has to be built right now by program, and the data right now would be segregated in terms of DC would have their own system, Virginia has its system. But if you have Careware, then you can import data into the system regardless of which part you are funded. Our expectation is that Provide is our client level data system for Virginia. So anyone who receives Ryan White Part B funding will be required to use the system, whether that means direct data input or whether that means importation from Careware. The system also allows us to do a number of different reporting requirements. To HRSA, it allows people to do their RSR reporting. There are lots of different advantages. So any agency in the Eastern region where we fund them for Part B will need to use Provide. We've not had discussions with the Greater Hampton Roads Planning Council whether their Part A agency is interested in procuring Provide, but right now, initially, we're having to get it up for the Ryan White Part B and get it functional across all of our subrecipients and our own internal use. And I think as things go forward, because Provide is already a generated system and we work with GTI to tailor it to our programmatic needs, I think that we'd certainly be interested in exploring whether they have instances where they can actually create shareability across Rhine-White parts, but keeps our data separate because of our own HRSA reporting requirements that we have to do, and we can't commingle their RSR data for us.
Thank you, Kimberly.
The committee, I will also add to that we have voting members, Part B members in each of the Rhine-White councils. So I am sure that Jonathan, who is our voting member for Norfolk, will be providing education and information about Provide and regular updates. And all of those agencies that we fund are also, welcome to take advantage of the training and technical assistance opportunities that we're providing.
And just to piggyback, yes, we just had a meeting this last Thursday and I provided some updates on Provide. Also letting them know where they can get training and who to contact if they're having any issues or if they need any assistance with, if they do have Rhine-White Part B clients, any assistance with the Provide. So we have been in contact with the TGA in Norfolk.
Great, thank you. Have you all thought about how housing someone at the local health departments to assist clients with this new system / eligibility updates or changes?
I'll take this one too. Our local health departments are have historically been great partners for us. Not only do they serve as medication access pickup points, but some of them also, and some of you on this call are also providing more Rhine-White services. COVID has taken a tremendous toll on our local health departments and their staffing. So this is not something that we have asked people to take on. Right now, they also have to, people have to be providing Rhine-White services to actually have access to this. And so I think when COVID kind of slows down and it's not sort of taking all of the oxygen in the room for our local health departments and they're able to then reestablish their regular programming, we would certainly start with asking our Rhine-White contracted local health departments if they can assist with any clients who are in that region, but that's certainly a topic that we would have to address down the road, and they will need to let us know when their capacity post-COVID could handle something in addition or something extra.
Kimberly, if I can add on to that, we have been working with the services coordinators for our contracted, not only our contracted local health departments, but also our subrecipients, in making that assessment if they need additional staffing to help roll out with unified eligibility. So that was something that we asked sometime last year at the onstart of talking about implementation of the unified eligibility. So our services coordinator and your services coordinator have been an instrumental part in during those assessments. So as Kimberly said, with COVID and everything happening at the local health district level, our services coordinators have been in contact with those contracted Part B agencies to see how we can best support them.
Great, thank you.
And also in our conversations about how we can best ensure that clients have other resources or avenues to help complete their eligibility updates. We actually, in the RFP that was just issued for our insurance benefit manager that's been under procurement for the last year, that was something that we actually added into the contract for them possibly to be able to assist us in eligibility updates going forward. So our IBM, the entity that won that contract was Benalytics. So that is something that will be another possibility, another way for clients to do their eligibility updates, and maybe not just at our subrecipient sites, but we'll be sharing more sort of as we develop that and start that new contract.
Great. All right, next question. If an assessment is rejected due to issues with documents that were submitted with the assessment and a case manager re-uploads the corrected documents, how will the case manager know if the assessment is no longer rejected and is being processed?
Well, if the assessment was actually uploaded through the web portal, you always have that confirmation number to know whether or not something has been rejected or when it's been processed. So if you went back to the web portal and uploaded those documents, the staff internally actually has to go. It's not an immediate, an automatic association with that existing assessment. The staff actually has to go find the documents in a separate queue and attach them to the assessment in order to link them and then to process it again. This is one of the things that we were saying, that as we moved into getting all the subrecipients into the Provide system, this is why it's more advantageous for you to do all of your assessments and your document uploads in the Provide system itself, not using the web portal, because it's an immediate association there, and the team can easily see it and work through it without having to go looking through several queues to find your documentation. So and with that said, you should be able to, within the Provide system, you should be able to look and see assessments that you've actually done. You should be able to look and see whether or not the team has actually approved them. This is something that was asked in our prior, those technical assistance sessions that we had. So it's something that at our next session, we're gonna kind of walk you through where to go to look and find this information. But you should be able to see when something has actually been approved in the system.
Thank you, Kimberly. All right. As mentioned, with the implementation of new systems, there will be kinks to smooth out. Can you tell us a little bit about how VDH is working to reduce technical challenges to clients and subrecipients?
Hey, Camilla, this is Kimberly Ely. I just wanted to add to that, as I was talking previously about Benalytics being able to assist with eligibility assessments, I just want to also add that our retention coordinators, they will also be able to assist agencies with these eligibility updates. Remember, we're adding retention coordinators on board to have at least one in every region. So that would be another resource that we can use and coordinate with our subrecipients in order to get eligibility updates done. Now, the question regarding working out, what are we doing to reduce? Is this the question about reducing the technical challenges, Camelia? Okay, so just as a reminder, I've kind of said this from the start since we started with Provide, and it is very true, and we see it every single day. That we have many, I won't say many, there are quite a few, there are kinks to work out. And it's some of them are actually kinks within Provide itself. Some of them are just kinks in just individuals knowing how to properly maneuver and work within the system. So to that end, please keep in mind that VDH established that dedicated email support address where you can email your questions or concerns or any difficulties that you're having there. There is a team of analysts, and Tina Gorman, our data manager, along with Tanika McIntosh and a few others, they're the ones that are manning that and trying to get back to you guys with responses on any issues that you're having. So please try to utilize that as much as you can to let us know about your challenges. Some of you have been giving great information there, and we've been able to see where there were some issues and just how some things were set up in some of your user profiles. And we've been able, because you reported it there, we were able to troubleshoot some things with GTI that helped us fix many people across the board that were having that issue. So we do need you to try and use that as your first stop when when you have some type of issue or concern with provider maneuvering in it. Also keep in mind, one of the ways that we're trying to understand everyone's challenges is having people participate, our sub-recipients participate in these weekly technical assistance sessions. So you can talk to us there instead of just emailing. You can talk to us there about the concerns and challenges that you're having. We can do as much as we can to talk through those. And if we can't actually answer your questions there, we're actually going back to those who may be who have those answers for us. And we're starting to populate those into a document that we're actually going to, so like a frequently asked question document that we've actually sectioned out by the type of questions that are being asked. And we're posting that to that dedicated provide page. And we're gonna put that, if we can somehow, can we put that somewhere where they can see it in a chat or something? Just remind them that there is a dedicated provide page that will have all the general information that can help you maneuver in the provide system.
This is Kimberly S. I'd also like to add something to that response. And some of the things we're also doing is to make sure that you all have training materials. We are requesting that GTI produce user manuals, and as we get feedback, some of it is written, some of it has screenshots. We're providing technical assistance and training on a regular basis. We're going to be partnering with the VACAC and asking them to help clients learn about the system, what's still needed in an assessment. Those things do not change. We're just giving you a system to put a centralized document system to put these documents in, and we're changing the frequency that you have to submit documents, and we're asking you to do those client assessment reviews or CARs on a regular basis. In your contracts, we're also asking you to start doing health literacy checks, which include an assessment of people's insurance status and insurance coverage and what they might be eligible for. All of this kind of feeds into the eligibility assessment in terms of making sure that we get clients into the right service category, if they can be enrolled in Medicaid, if they can be enrolled in an ACA plan that Virginia MAP supports. We're also, as we said, and then we also have other agencies, other parts of our agency that are assisting clients in trying to access the web portal. So we engage people on our DDP hotline. So with VACAC as an important partner there and the feedback, but we are asking you all, please use the resources we are providing to you. We're having to learn the same system that you're having to use, and we really do appreciate, probably more than you all might know, your frustrations in terms of how do you access this? Our logon isn't working. Kimberly, Ely, and Ashley, my password is no longer working for Provide. Can you get me into the system? So we are actually taking your feedback and figuring out what can be a systems change, what can help us do our provide our resource materials and update those, what goes in the FAQs, what goes in the actual training. So we'll figure this out together. And I think the more we use it, the more we'll be excited, I think, about having, for the first time, everyone having access to a client level data system that you can do direct data input into, that you can get information from, that you can check the status of someone's eligibility. I think that that's going to be pretty exciting for everybody once the system is running smoothly.
Thank you for the clarification. Okay, and I did get the information for the website. I'm not able to post it through the CVent platform. So we'll make sure that we share that with the VCU partners, that it will be available to everybody on here. For the next question, it says client has Medicaid or private insurance and doesn't want to take or have any benefits from Ryan White and has been discharged. Why do we need to find this individual for any eligibility process? So I think this is in reference to possibly a client that is not case managed, if I'm reading this correctly. And so I'm trying to clarify that this question is saying, why would the agency need to find this individual for any eligibility process if they've been discharged?
Been discharged from Ryan White, from discharged from the other insurance coverage.
I think we need a.
I would say just based off of at face value of the question, we would need some clarifying, things to make sure we're answering and addressing your question properly if we don't address it here. But if you're saying that the client has other insurance coverage and is no longer in Ryan White, then they would not be enrolled into Ryan White Part B or under the Unified Eligibility process. Remember that the Unified Eligibility is for Ryan White Part B services. So if they have to access Ryan White Part B services, then they would need to be engaged into a Ryan White contracted subrecipient to do the eligibility assessment. If they do not need Ryan White Part B services, which includes ADAT or VA MAP, and so let's make sure that's the goal of unified eligibility. And the benefit of unified eligibility is that clients who only need access to medication through VA MAP will only have one door to do that, and that's through the unified eligibility process. So if they do not need any Ryan White Part B services, then the agency does not need to contact this client for any follow-up. But remember what Ryan White Part B does, it really is to make sure that there are health outcomes for those living with HIV and providing the best resources and support services to ensure that clients reach a maximum health outcomes. And so making sure that the client has access to your agency, if you will, in case they do lose their Medicaid coverage or if they find a job and they lose their private insurance through their employer, that Ryan White is eligible, your agency, is available to assist them to make sure they have the coverage that they need. So hopefully that addressed that question for you. If you need further clarification, please put that in the Q&A so we can make sure we address it.
Thank you, Jonathan. Okay, and we had a question, somebody who was trying to answer a poll question that closed out. Their challenge is when they submit documents like the consent form, there's no way of knowing if it actually uploaded. How can we be sure before submitting? This is, I think, in reference to provide.
Typically, when you upload a document and you save it and close out of it, you're supposed to be able to go back. You're supposed to be able to go back in and see the documents that were uploaded. So if that's a challenge, I would say whoever's asking that question, if you could reach out to me directly, that'd be great. And me to kind of talk you through that process.
Okay, thank you. All right, up next, relating to benefits, we have been told that we are still responsible for the info uploaded in Provide to be in the client file for site visits. Has this changed?
So with the implementation of the Provide system, this sort of changes how eligibility looks. The idea is that all Ryan White B eligibility has to be placed in the Provide system. So we're starting to discuss here at the agency of how we would actually be, how we actually now need to view, how we basically sort of check that eligibility that's being done. There's typically in your annual site visits, your service coordinator has a certain number of charts that they use to check your eligibility and other requirements that they're contractual requirements that they're looking for to ensure that they've been done. So we're talking through, how that's going to look going forward. If all Ryan White eligibility information, including documentation, is in the system, that kind of, for us, we're like, maybe we do desk audits now on a more regular basis, rather than once a year to just check those things. There are other things that are, I think, that are checked on your site visits, and maybe Jonathan or Ashley or others can speak to this, but those other things, especially when it comes to some of the other services that are offered, if you're actually putting that information in the Provide system, it's there as well. We're not sure, we're still sort of talking through what information we may need to come to your site to actually see once everyone is fully utilizing Provide. So expect some conversations to continue regarding this, but how we sort of view checking some of the things that we looked at during site visits and during some of your monthly or calls, and some of you do some quarterly things, some of that may be changing.
Yeah, it's a new system, and we are building the system now. It's going to take several, stages, and incorporating other feature on the program development. But the ideal is to go away from any paper trail if the eligibility is fully electronically into the Provide, and that's the benefit of having the Provide service. We all can go there and pull the information we need.
And I would say, as we're going through this sort of transition period,
Related to
I think Safri's having some technical difficulties.
I would just add that as we're kind of going through this transition period, and we're all kind of learning, exploring the different functionalities that Provide now offers us. In the interim, until there's some sort of finality or directives given, you should, as a practice, maintain whatever documentation that you have for your eligibility on site.
Yeah. So as we move along, and we will tell you when the service is ready to move any site visit element to the electronic, device, and provide, you're gonna get update from VDH on that. But like I said, this is a new system. We're just working on it, and we're gonna be making changes on several areas of the program management.
So I know we're wrapping up time. I'll just say this to answer you directly. Do not change any of your process that you have not heard us or been directed to by VDH. So that does mean that you still need to keep that supporting documentation in the client chart until you receive further directions from us. As Kimberly, Ely, and Safri is saying, we are exploring the ability to reduce things and the administration burden, but please do not change any of your processes until you have that from official notice from VDH.
So Rob had some questions from yesterday. Can we answer those to fill the time?
I believe we're out of time. And we actually have some questions we didn't get to. But what we can do is we can continue this conversation, as VDH is in contact. We will continue to provide updates to all of our participating subrecipients, and just make sure that this is an ongoing conversation. Thank you to everyone for asking your questions, and to the panelists for your thoughtful responses. And I will turn this over to Rob.
Hi, everyone. So we're just wrapping up the session. Just a quick plug for the questions we didn't get to today. There is a VDH town hall that is part of our monthly case management webinar series. That is scheduled for April 26th. My camera is here, I'm just realizing. That's scheduled for April 26th from 3 to 4 p.m. And there's a link to register for that at the top of your screen in the helpful links tab. You can also submit any additional questions that are there. For the person who had any urgent medication access issues, please contact Kimberly Ely directly. Thank you all for joining us. You'll head now into your networking and breakout sessions. So speakers, on behalf of the summit planners, thank you for being with us today. We will now transition into our networking break. The networking breaks are designed to provide you an opportunity to learn about and network with colleagues from around the state. We encourage you to visit the agency pages and meet staff from other agencies. You can also explore the special topics rooms. There are discussion rooms for medical case managers, non-medical case managers, agency leaders, and even a discussion room where you can meet with VDH staff. Please enjoy your networking break, and we'll see you in the breakout sessions at 11 a.m. Thanks, everyone.